porque só
O
tenho 4 participantes.
anfitrião, tá.
Ok.
Right.
Ok.
So, Sabine,
Yeah,
is it gonna be like usual where you make small breaks for questions?
should I?
I don't know. Like,
It depends on
Yeah,
you.
maybe I do. 1 or 2.
okay. So I'll just tell people to write the questions in
Yeah,
the
yeah,
chat section and
yeah.
then
Yes, please.
okay.
And
So,
Alex,
Yes?
let's do a group photo. We need it for promotion.
Okay. But at the beginning or at the end?
No,
better at the beginning.
what's the best? That we can see a full screen with many faces.
Okay. So at the beginning, I guess.
Yeah?
But then she needs to stop sharing.
Yeah, you need to stop
Oh,
sharing.
no. Then we do it at the
We
end.
do it at the
I
end.
think it's the
Okay.
best.
Okay.
Yeah,
Okay.
at the end.
Let's start because it's already.
All right, let's give it a start.
Okay. Are you still here?
Yes, absolutely.
Oh,
We're
okay.
letting people come in.
I don't see anything. I'm lost. I'm so alone here.
Hello.
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 Hello, Sabine.
Okay.
Hello. I can't see anything. I'm just
Good
seeing
night.
my 2 screens. Hello. I have
Hello.
no idea who is in at the moment.
Hello, everyone. We're sorry we're starting a little bit late. Thank
It's
you for
my
your
fault.
patience. No,
I
it's
had
also
technical problems. Sorry, my fault.
it's also ours. So before we get started, right away, um, I just wanted to tell you two things. The first thing is this is being recorded. So if you don't want your face to be shown or your voice to be recorded, make sure to keep those off. Also, just as a matter of dynamics of this free webinar, if you have any questions, make sure to write them in the chat and Sabine will answer to them when she sees fit. And without further ado, we can start. Thank you so much to Sabine for accepting doing this with us. Thank you all to be present today and trusting all branches with these kind of classes. Thank you, everyone.
Thank you, Alex. And I have to excuse myself. It's absolutely my fault. I had, again, technical problems. And as Alex said, please, if you have questions, any comments, please write them down. And I think Alex will help me because I can't see the comment fields.
Absolutely.
I just can see my screen and that's it. So waiting for your comments and questions. Okay. Welcome to today's webinar on an eczema case study. My name is Sabine Schmitz, and I look forward sharing with you how we gained wonderful healing results in a very, very challenging case. If you see the pictures, you will see what I mean with very challenging. And as I said, I will present to you a very difficult case of eczema where the patient had open leg wounds, what we were able to heal quite quickly with Chinese medicine only. I have to say we didn't use acupuncture and anything else, just Chinese herbal medicine. But first of all, I like to tell you a bit about me and how I work. Many of you already know me, but let me start a quick introduction of myself and my approach to treatment for all those who are new. I've been practicing in the medical field for now around 30 years, combining TCM and Western medicine. I hold a master's in TCM from China, specializing in dermatology. My clinical focus is on skin conditions and gynecological disorders. I've authored the first TCM dermatology handbook series published outside of China, covering conditions like, as you see on the picture, psoriasis, acne, rosacea, eczema, and neurodermatitis. I also founded China Mid Cosmetics, developing TCM skincare based on Chinese herbal medicine made in Germany. And currently, I serve as a chairwoman of the TCM expert committee at the World Sinology Council in Beijing. If we have time, and if I don't forget it, I will tell you a bit more about this project at the end of this PPT. And finally, I like to say I see me as a full-time TCM practitioner in the first place. All other activities come on top. And what I love most is helping people, treating patients with Chinese medicine, our wonderful medicine.
Sabine, I'm sorry to interrupt, but are you moving the slides?
I didn't skip.
Okay.
Sorry. It's always the same.
It's
So
all
here
right.
you see the wonderful book. And this is it's always the same.
It's okay,
And
don't worry.
And I hope it's okay if I don't repeat it. This is the About Me page. And this is, I think I'm now at the correct slide. And I try to don't forget to skip the slides. I'm sorry. So if you wonder how I work, first of all, I think my treatment philosophy is built on simplicity. So I focus on what works rather than overcomplicating things. Herbal medicine forms the foundation using both internal and external applications for skin conditions with acupuncture as an optional addition. So acupuncture is a can, it's not a must. And I believe in making TCM accessible through moderate, cost-effective prescriptions. So our wonderful medicine should be available for everyone. Every treatment includes holistic lifestyle, diet, and skincare guidance. I think this should be clear. I'm sure you are all doing the same. And sorry, I have some technical problems again with the slides. Okay, so now I like to share how I approach patient care. I maintain clear professional boundaries. As an expert, patients come for solutions based on my knowledge and experience. And when I know a treatment is right, I communicate this quite clearly. My treatment decisions are based on professional judgment and my clinical experience. So this isn't about being rigid. It's about providing expert guidance. So when patients seek TCM treatment, they are looking for qualified professional help, not a discussion forum. This mindset helps to establish respect for TCM as a serious medicine and ensures the best outcomes for my patients. And I'm saying this because whenever you think herbal medicine is best, say it. It's not about making it comfortable for the patient. It's about making it most effective for our patients. It also doesn't matter whether decoctions taste well, taste pleasant, taste horrible, doesn't matter. It's all about the effect. And some of you may know why I'm saying this, because I hear from time to time that colleagues have problems giving raw herbs to their patients. So if you think it's the best, prescribe it, no discussion. Okay. Now let me walk you through my TCM syndrome differentiation, which is, I think we all know, the detailed analysis of all clinical information. I think you all know how it works. This systematic process I follow with every patient. So with every new patient, I start asking the questions, what can I help you with? Or what's the reason you are here today? And that everything follows naturally. Usually I say, if they sit down, I say, tell me everything. And if you are ready, I jump in with my questions. And you can think of it as a kind of detective work. We analyze all clinical signs to reveal the full pattern, and that's our target. So now I like to explain the TCM syndrome differentiation. I think this is not really new for you, right? So we have our 4 methods: inspection, auscultation, palpation, olfaction. I think we all know. But for skin diseases, our main focus is on the skin, always on the skin first. So always keep in mind, in TCM, I say it again and again, TCM dermatology, we treat what we see. We don't treat a Western diagnosis. We don't care about the Western name. We treat the appearance of the skin, the TCM pattern. So our main focus is on observing the appearance and localization of the skin lesions. Is there any inflammation? Is there any pus? Is there any discharge? Yeah, is there scaling? And of course, we do the tongue diagnosis. Second method, listening. Of course, we listen to the patient's report, the symptoms, what happens on the skin, how does it feel, the history. Yeah, we ask about other factors, emotions, sleep, digestion, any medication, menstrual cycle in women, dietary habits, lifestyle, and so on. Never go without this. Then we feel the consistency and the mobility of the lesions. Is the skin painful on touch? And feeling also includes, of course, the pulse diagnosis according to Chinese medicine. I think I don't have to repeat this today. Fourth method, smelling. Of course, we can smell. Is there any body odor? Sweat, bad breath, food odor, tobacco, smoking smell, personal hygiene related smells, chemical odors like too much perfume, deodorant, etc. Yeah, so this is how I work. I think you are doing the same in practice. I like to give you important notes for the tongue diagnosis. So about 2 weeks before the appointment, I send each new patient important preparation guidelines. No food or drinks that could stain the tongue for 2 to 3 hours before the visit. Don't scrape or clean the tongue for 2 to 3 days prior the visit. And these instructions are crucial for an accurate TCM diagnosis. This gives me the opportunity first to remind the patients on their appointments. You know, I don't know how it is with you, but for me, usually new patients make their appointments 2 or 3 months, maybe sometimes 4 months in advance. And so I can remind them, hey, there's your appointment, and giving all the necessary information in addition. So I like to give you also some important notes for the pulse diagnosis. I think most of you know some things can falsify the pulse. For example, medications can affect the pulse. Antibiotics, they create cold and damp signs. They make the pulse slippery. They make the pulse slow. Cortisone brings heat inside the body, makes the pulse rapid. Beta blockers create cold signs, make the pulse slow. There are other factors like nervousness, tension, coffee. They create heat signs, making the pulse fast. After main meals or during pregnancy, for example, make a slippery pulse. Also, a dislocation, and this is very rare, but at the moment I have one woman, she has a dislocation of her pulse, and I just can feel the pulse at her right wrist. Left, not possible, because she has an atypical course of her vessel. It's just not possible to feel it, so I have to work with one side. So this is rare, but this can happen. I like to give an important safety note. Whenever you feel an irregular pulse, please refer your patient to their general practitioner or to a cardiologist. I think it's essential to stay within scope of practice. Sometimes if I feel an irregular pulse, in most of the cases, there isn't any serious issue. For me, what often happens, it's often an emotional issue, an emotional problem, maybe an argument the day before, something like this. But this has to be clarified. Okay, now right slide. Now let me walk you through how I evaluate each patient. I follow a systematic approach that combines careful observation with detailed TCM diagnostic methods, like you have seen at the previous slides. I start from the moment the patient walks in, and I think you do the same. I observe their overall appearance, the body language, the energy level. This initial impression is followed by a precise skin examination. As I said, when treating skin condition, the focus is always on the skin first. I look at factors like the color, the texture, is there any oozing, any pus, etc. But this is just the beginning. I gather information about the accompanying symptoms, perform the tongue and pulse diagnosis. All this information comes together to create the patient's effective treatment plan. And always keep in mind, this is also not new to you, a key principle of TCM. There are no standard treatments. Each patient receives their own individualized plan. That's why precise assessment and clear communication are essential for successful treatment. We all know it, but often new patients, they are not aware that we are working totally individualized. And sometimes I really have to explain this, but finally they are happy to hear it. So for new patients, I always say this at the end. I say you are getting an individually tailored prescription, absolutely adjusted to you, to nobody else. And I think that's why they are coming to us, to getting an individual, a natural and effective treatment. But now let's start with our eczema case. So as I said, our today's case was a really, really complex eczema case that powerfully demonstrates TCM's effectiveness, even when Western treatments have shown limited success. I have to say, prior to seeing me, this patient had spent 4 months seeking help from both dermatologists and his general physician without any improvement, nothing. Okay, now let's start. It was a 53-year-old male with multiple serious pre-existing conditions, like hypertension, COPD, hepatitis C, hemophilia A, and I didn't write this down, also AIDS. 7 months before seeing me, he experienced a critical medical event, a pulmonary infarct with cerebral hemorrhage, requiring an induced coma for him. So while his hospital treatment, including necessary additional medications on top of his already existing prescriptions, it was the continued use of the diuretic toracimide after discharge that triggered the severe skin problems we will discuss today. And I have inserted one of the many pictures I have from this patient to show you how serious it was. Okay, and you will see many, many pictures today. I like to give a brief comment about terminology. While this case was classified by the general practitioner, by the Western dermatologists under the Western term endogenous eczema, typically meaning eczema that develops from internal factors rather than external contact, I strongly believe this was clearly medication-induced. It's particularly noteworthy that this obvious connection was overlooked, and sadly, the patient's concerns weren't properly addressed. You must know this patient himself had also suspected that his medications were triggering the skin problems, but they didn't want to hear it. Nobody wanted to hear it. And this is very, very sad. And he was suffering for more than 4 months before coming to me. What should I say? And this case highlights three critical points. First, distinguishing between true endogenous eczema and medication-induced cases is absolutely crucial for effective treatment. Second, dismissing the patient's own observations led to unnecessary suffering and ineffective treatment approaches. 4 months. Incredible. Finally, recognizing the pharmaceutical trigger was a key to resolving this case. I will talk later about this. And another key point here, knowledge of Western medications, their effects, but also their side effects, combined with clinical experience of similar cases, allows for much faster pattern recognition and diagnosis. So for this patient, for example, he told me all my skin symptoms appeared with the intake of toracimide. And I had, was it two or three patients before who had nearly the same. They took a diuretic medication. In Germany, it's called Ramipril. Toracimide is, I think it's the international brand name. In Germany, we call it Ramipril. They took Ramipril and they developed an overall rush, itching all over the body. And if you have seen those cases, you know for the next time, and you know the correlations. So this definitely helps. But now I like to continue with the appearance of his skin and his lifestyle. This patient was referred to my clinic by another patient, and his presenting symptoms included bright red, scaly, intensely itchy eczema lesions covering his whole body. Particularly severe open lesions on both lower legs. I will show you pictures. Heavy dampness and exudate, yellowish crusting, warmth and burning sensation, intense redness and peeling on his neck, severe swelling in ankles and feet with red purplish discoloration, also with spider veins. And adding to this complexity, his lifestyle factors were worsening his already poor health status. These factors included smoking, excessive coffee consumption, and alcohol use. What should I say? His accompanying symptoms included trunk obesity. I will show you a picture on the next slide. A red face with spider veins, joint swelling and joint pain, afternoon fatigue, poor morning appetite, soft stools, once to 3 times daily, post-meal fullness, night sweating with heat sensation. As I checked his tongue was thick and purplish with a yellow coating. His lips were also purplish. His pulse was slippery and slightly rough. And there was a notable weakness in kidney and spleen positions. And here I'm showing you a picture of him to illustrate his trunk obesity. You can also see the small intense red lesions covering his whole body. But this picture is mainly for showing you the trunk obesity. And I'm showing you a similar tongue presentation. This is from another patient. I have to apologize. I didn't take a picture of his tongue, just forgot it. And it shows the same characteristics. We saw a thick and purplish tongue with a yellow coating. And before we look at the patient's skin pictures, I want to explain how I use the concept of analogies in TCM dermatology to understand and treat skin conditions effectively. And this is how I work. So what I do mean with analogies in TCM, it just means making nature-based comparisons in TCM diagnosis. The big idea behind this is TCM believes that what we see on the outside tells us what's happening inside the body, just like in nature. So we link body parts to things in nature. For example, the liver works like a tree, growing and is flexible. The heart is like fire, gives warmth and energy. Spleen is like earth, provides stability. Lungs are like metal, provide structure. Kidneys are like water, help things to flow. We gather all these information through diagnosing the body surface colors, tissue changes, tongue appearance, pulse, facial color, and so on. All these external signs reveal internal conditions based on natural correlations. I think many of you know, but this is how I work when treating skin diseases. So by observing external signs, we can identify internal patterns and conditions. The natural analogies serve as a framework to classify and understand complex physiological processes. It works super in diagnosing skin conditions, at least for me. So another slide to give you more examples, but please note this is just an overview about analogies. Detailed applications are covered in my courses, not here, not today. I like to give you an example of wind analogies, and I think many of you know. Like wind in nature that moves quickly, yeah, and changes direction. Wind patterns in the body show trampling and shaking movements, wandering pain from joint to joint, a sudden onset of symptoms that come and go, facial tics and muscle spasms, dizziness with a sensation of swaying, itching that moves around the body. This is the example of wind analogies. I like to give you examples of heat analogies. Like fire that burns upward and creates heat. Keep in mind, heat is light. It always goes up, makes symptoms almost always on upper parts of the body. Heat patterns show a red face, red eyes, fever, feeling hot, thirst with desire for cold drinks, quick pulse, like rapidly burning flames, a bitter taste in the mouth, yellow urine like concentrated fire, agitation and restlessness like rising flames. Finally, dampness analogies, like moisture that is heavy and tends to sink down. Keep in mind, dampness is heavy, always goes down. You won't find pure dampness-related symptoms on the upper part of the body. Nearly not, yeah? So dampness patterns show a heavy sensation in the body, especially the limbs. Swelling like water retention, sticky secretions, a greasy tongue, coding like accumulated moisture, sluggish digestion, like stagnant water, mental fogginess, like a humid day. For example, if you have dampness inside and dampness comes from outside, the symptoms will always worsen. This comes on top. So if patients have dampness inside and we have a super humid day, they feel totally weak, foggy, cannot concentrate, because this makes it even worse. Last points for dampness, joint pain that feel worse in damp weather, the same. Symptoms that persist like moisture, that it's hard to dry. These patterns can also combine just in nature. So wind nearly always, at least in skin conditions, combines with heat. Dampness very seldom alone, usually often combined with heat, so damp heat. So this is my concept. And yeah, I can say if a patient walks in and if I see the skin lesion, it's relatively easy to know the pathogenic factor. You can see, is it heat? You can see, is it damp? You can see, is it damp heat? You can also see, is it blood stasis? Because everything has a different color, different signs. It's relatively easy. And we also can feel what does the pathogenic factor make in the body. Yeah, does it produce a burning sensation, a warmth sensation, a heavy sensation, and so on? So this is working with analogies, and yeah, I would be happy if you could see it too if a patient walks in. And now we come to the skin presentation. And here, I hope the pictures are big enough. Couldn't do it in a different way, but I think it should be clear. You see intense red on both legs. Is really intense red. Open sores, exudation, crusting, scaling. You see on the right picture, you can see a purplish discoloration. And yeah, we can see some spider veins on his lower leg. You can see how serious it was, his skin totally peeled off. If I'm too fast with the pictures, please give me a sign, because I can't see if any one of you writes a comment. Here, other very nice pictures, and you can imagine how painful this process was. Open wounds, peeling, a very intense red. If you see this intense red, you can imagine, of course, there was a warmth sensation, a burning feeling. Skin peeled off, exudate, and crusting. And in this case, we have to be very, very careful about contamination, about potential superinfection. I come to the next slide with other pictures. Here we can see again, the skin totally peels off. You see the ankle swelling, the foot swelling. You see the red and purplish discoloration. You see the crusting, the open sores. And some more pictures. Foot swelling, ankle swelling. You see how big it is. His skin cracked, and you see this yellowish crusting, and yeah, to give you an impression of this patient. And as I have said, he had scaling on his neck, the skin peeled off after his ears. And these were all pictures for the first visit. I hope I was not too fast with the pictures. And I came to the following conclusion. My TCM diagnosis, in this case, was blood stasis combined with yin deficiency and dampness. My treatment principle in this case was promote blood circulation, remove stasis, nourish yin, clear heat, remove dampness, and moisten the skin. The treatment approach combined internal decoctions with external cold wet compresses, which proved as very, very effective for those kind of skin lesions. So wet compresses in particular are when lesions are open and oozing. We want to make the skin heal and speed up the healing process. So never go without wet compresses or maybe washes in such a case. You will get faster results. So never go without external treatments if you see such a kind of skin conditions. And I like to explain the steps of how I created this diagnosis, of course, and the treatment plan. So here, this is a case with many, many chronic conditions, including, I repeat it again, COPD, hemophilia, AIDS, hepatitis C, along with fatigue, joint pain, all this for a long, long time. So we see here a lot of signs of wear and tear, but also heat and night sweats. And this was yin and blood exhaustion. But it's not all. Blood stasis was obvious. You could see it on his purplish tongue, purplish lips, the slightly rough pulse, spider veins in the face, on the legs. Also, the skin discoloration on the legs. If you look very, very carefully, you see all these signs and you definitely see this skin color. Also heat. The skin was red, felt warm, with a burning sensation. This is obviously heat. Itching, heat, but also his smoking, high coffee intake, and the alcohol, yeah? All this makes heat, we know it. And that the spleen was not working sufficiently, we could see on symptoms of afternoon fatigue, poor morning appetite, digestive issues, but also a thick tongue and the slippery pulse. All this showed a weak spleen and dampness, and of course we have to support the spleen's function to resolve the dampness. I like to give an additional information on dampness. So whenever dampness is there for a long, long time, it always transforms into heat, always. And if we have dampness combined with heat, we see in this patient oozing sores on his lower legs and yellowish crusting. And as we have seen all the skin lesions and his lower legs, you may remember I said dampness always goes downwards, always sinks down. So it's relatively easy to diagnose that it's dampness and heat, and of course his tongue coating. You may remember it was thick and yellowish. You may remember the picture. So again, I like to repeat the treatment principle, which was promote blood circulation, remove blood stasis, nourish yin, clear heat, remove dampness and moisten the skin using the following ingredients. Sheng Di Huang, Chi Shao, Cao Mu Dan Pi, Xi Xue Teng, Cao Huang Bai, Cao Chi Mu, Dan Shen, Lian Shao, Gan Cao. Raw herbs to be taken as a decoction for 10 days. And I instructed him to take 130 ml twice a day. So this formula addressed the blood cooling and heat clearing, as well as the blood moving and transforming blood stasis aspects. I used dry fried cao for bitter herbs to protect his digestion. You may remember he had some digestive issues. And if you look very carefully at this formula, you may see the formula Zhi Bai Di Huang Wan, which is very, very effective in clearing heat from the lower jaw, as well as nourishing yin. But also, again, if you look carefully, you can see components of Xu Fu Zhu Yu Tang, focusing on moving blood. And all this clearly demonstrates that you can easily construct and modify standard formulas. You always take the components you need, and classical standard formulas serve you as base. Very, very easy. And I like to analyze the herbs for you. Sheng Di Huang, Chi Shao, Dan Shen, Mu Dan Pi, cool blood, clear heat. Ji Xue Teng not only moves blood, it also soothes the sinews, unlocked channels and collaterals, and this herb was selected to address the patient's joint pain. You may remember he had joint pain. Jimu and Huang Bai nourish the yin, clear heat, but also strongly drain fire, especially from the lower burner. You may remember Zhi Bai Di Huang Ban. These are components from Zhi Bai Di Huang Ban. Lian Zhao clears heat, resolves toxicity. And then we have Gan Cao for harmonizing the whole formula and supporting the spleen. As I have said, I also used external wet compresses for enhancing the skin healing. I used Kushen, Di Fu Zi, Bai Xian Pi, Huang Bai, Huang Lian cold compresses for both legs, 20 to 30 minutes each time, twice a day. Please advise your patients to always work cleanly when using external treatments and to avoid contamination of the liquid in any case. I think this is clear. And please keep in mind, whenever a skin is oozing, never use thick creams. The skin must breathe in order to heal. So when you see open sores, discharge, pus, always use compresses or washes. Never, never a thick cream would make it worse. And I like to talk about the medication, about the toracimide. The key points about toracimide: it's a diuretic medication for fluid retention, and it can trigger skin reactions. The common side effects include skin rashes, itching, blistering. And if we look at the patient's timeline, his skin symptoms appeared immediately after starting. He repeated it again and again, but nobody wanted to hear. Important patient safety notes. I think patients should be informed about this. never stop systemic medications without consulting the prescribing physician. A gradual reduction of systematic medication is essential, and professional pharmacological consultation is recommended for those complex cases. Unfortunately, this is nearly never done. I mean, what are pharmacologists for? I just don't understand. For this patient with this scale of medication, a pharmacological consultation in advance, before seeing me would have made most sense. But it was like it was. And your practice takeaways, we as TCM practitioners also need understanding of Western medications and their effects, the ability to recognize medication-induced patterns, the knowledge to guide patients towards appropriate medical consultation, like a pharmacologist. Oh, and his dietary and lifestyle, I should not forget. In cases of chronic conditions combined with long-term lifestyle factors like a poor diet, smoking, alcohol consumption, herbal treatment alone is not sufficient. It's just not enough. Successful treatment outcomes require active patient participation in lifestyle changes. The effectiveness of herbal medicine is limited unless underlying lifestyle factors are addressed. Inform your patients about this. Yeah, I always say we are like a team. If you don't work at home, the effect is not as we wish. And I also say, I do my job by informing you, but what you do at home, it's your business. And I usually treat adults. I say it once, I say it twice, and I did my job. What they do at home, I can't change. It's definitely their responsibility. Alex, are there any questions or comments at the moment?
Yes, there was precisely someone who asked if he had stopped taking the diuretic
Later.
later.
Yes, he did. Yoo-hoo.
And
Yeah.
then Melissa is asking, can eczema not be itchy?
It was itchy. I
Yes,
didn't get the question.
yes, but can eczema manifest itself without being itchy? Or is it always?
I see it very seldom, I have to say. Usually it's always itchy.
Okay.
Itchy from dryness or itchy from heat.
I see.
Of course, the severity of the itchiness depends. There are variations, but usually a bit itchy always, at least
Okay.
for the patients I have seen so far.
Very well. And
Okay.
then finally, Valentina says, in your opinion, are lifestyle habits more relevant than emotion management? For example, this person in specific was maybe an overthinker, which contributed to spleen weakness.
It's a
That's the
good
question.
question. Emotions are a big part of my practice. And if you read my books, emotions are very detailed explained. What I see in practice that emotions are in nearly each case the cause of skin conditions, especially for neurodermatitis, psoriasis, even acne, also rosacea. You're absolutely right. Yeah. But for this patient, it was a bit different. But therefore, it's good that you're asking this question. For this patient, definitely his lifestyle factors. This case was from, I have the patient record here. It was from June 2020. I remember his face. He was a funny guy. He was nice. He was sitting in front of me with his wife, both very kind persons. But his lifestyle was a mess. really. And usually I don't have any problems, to explain that they should change their lifestyle. But he was so resistant, and he nearly changed nothing. So for this patient, his lifestyle, not really his emotions, maybe in the past, but lifestyle for this patient. I hope I could answer your question. So as I have said, I gave the medication for 10 days. I saw him at his 10-day follow-up, and his treatment response was a minimal change in leg skin condition despite consistent formular use. I was not happy with the result. I have to say, you will see the picture on the next slide. I was really not happy. A reduced ankle and foot edema, but he reported new symptoms like itching at night, cold extremities. His tongue remained purplish with a thin yellow coating, and his pulse was still slippery and slightly rough. His kidney position improved, but his spleen position remained weak. And now I show you pictures of his skin. So after 10 days, and you must keep in mind, not just decoctions, also wet compresses. For me, it was not enough. I was not happy. You see, minimal changes. So, okay, I adjusted his formula, of course. Makes no sense to go ahead with the same formula, right? So I adjusted the formula to focus more on the blood moving aspect while continuing the to nourish yin, clear heat, and remove dampness. And I used the following herbs: tauren, dangshen, dangui, chuanchong, chishao, niuxi, shengdi huang, tufuling, chaihu, gancao, cao mu danpi, cao huangbai, lianshao. This basically is a modification of Xu Fu Zhu Yutang. And the main effects of Xu Fu Zhu Yutang are to stimulate blood circulation, remove blood stagnation, move qi, and unblock the channels. And I added tufuling to enhance the heat clearing process, reduce redness and swelling. And as I said, this case is from 2020. If I look at the dosages, maybe you can increase the dosage, just to give you some examples, of Shengdi Huang to 15 grams. Do the Tufuling 20 to 30 grams. Chaihu 3 is okay. You could also use 6 grams. Be flexible, just as you need. The other ones I would leave it that way. If I'm too fast with the slides, please let me know. So I like to give you the formula analysis again. In this formula, as I have said, it comes from Xu Fu Zhu Yutang. Tauren invigorates the blood and breaks up blood stasis. Dangui nourishes blood. Xuanshong invigorates blood and promotes movement of qi. Shishao Danshen invigorate blood, cool blood, and clear heat. Niu Xi is for circulation. It eliminates blood stasis, inducing downwards movement of blood. Chaihu, we know, qi regulation. Shengdi Huang cools blood, clears heat, and boosts yin. Finally, Gansao is for harmonizing the formula. And as I have said, I added Tufuling. Tufuling enhances the heat clearing, reduces redness, and addresses the swelling. And those 3 herbs remained: Mudanpi, Huangbai, Lianshao. You may remember Mudampi boosts heat clearing and blood cooling effects without injuring the blood and yin. Huangbai clears heat but also strongly drains fire, especially from the lower burner. Lian Shao clears heat and resolves toxicity, and I gave him this formula for another 21 days. So 3 weeks with this formula. I did wet compresses again, consisting of Kushen, Difuzi, Baishen Pi, Huangbai. Wet compresses on both legs, 20 to 30 minutes each time, twice a day. And if you are interested, I give my standard cooking instructions at the end of this PPT. Okay. And then I like to share with you the 5-week follow-up results. Picture comes later. So the key improvements were a significant skin improvement, really, really significant, completely different than before. A reduced redness, a complete resolution of itching, no more open sores. Thanks goodness. Yeah, they were completely closed. Better energy levels, a stable digestion, 2 stools daily now. You may remember up to 3 times before. But we had some new developments. The return of night sweating, ankle swelling with warmth and pain. And now, someone has asked before, he discontinued the Thorasimid independently. But it was good for him. He did it without any consultation to his general practitioner. But to be honest, they wouldn't have hurt him anyway. So now he discontinued, and his tongue, other clinical signs, his tongue improved, was slightly purplish now with a thin yellow coating, but this thin yellow coating remained. His pulse improved, was still slightly slippery, but not longer rough. His spleen position still showed a mild weakness, but we had a notable outcome. The combination of herbal treatment and medication discontinuation showed significant positive impact on his skin condition. Yeah, particularly noteworthy given previous lack of response to Western medicines. And keep in mind, this just within 5 weeks. So, and this is the picture of his skin after 5 weeks. You can see, no more open wounds, mild redness, the purplish discoloration is also not visible anymore, no oozing anymore. And this was a stage where the skin was in a healing process. And of course, he received an adjusted prescription. And giving to the significant improvement, I gave him this herbal prescription for another 3 weeks, balancing the treatment of blood stasis with heat and dampness clearance. The formula consisted of Shengdi Huang, Cao Huangqing, Chi Jianzi, Ce Xie, Cao Mudampi, Cao Huangbai, Pu Gongyin, Danshen, Zilan, Baishen Pi, Gansao. And with the skin is now or nearly fully healed, the external treatments were discontinued. I scheduled a follow-up appointment with him for 3 weeks' time. have to check the slides. Okay. So this is week 10. Let's discuss the final treatment outcomes. As you can see on the picture, the skin completely healed within the last weeks. We had a resolution of ankle swelling and also the pain. If I look to this picture now, sometimes it totally looks different. Sometimes one could wonder, is it the same patient? You may remember the swollen ankles, yeah, the swollen feet. But here, very slim, yeah, it's great. And of course, he had no pain anymore because it was not swollen anymore. So the primary treatment goals were reached. So let me give you the patient status summary. Primary complaint, his skin condition was resolved. His chronic conditions require ongoing Western medical care, of course. Lifestyle changes acknowledged, but challenging for him. As I have said, he didn't stop the coffee, he didn't stop alcohol, he didn't stop smoking, a very resistant patient. Sometimes it happens. What are the long-term considerations for this kind of patient? So this patient still continued his unhealthy habits for whatever reason. He has to understand the importance of lifestyle modifications. This is so important. I said to him, if you have ever something else, I'm here for you. Give me a call, send me an email, just come in and I'm happy to help. So whenever patients have finalized their treatment, I always say, I'm here. Before you take any Western medication, come to see me and we try TCM. So maintaining the option for future TCM treatment. I encouraged him to continue Western medical care for chronic conditions, for his chronic conditions. I think this is self-explaining, but for this patient, I have to say he was so disappointed. Of course, he was disappointed. Nobody wanted to listen to him, and no treatment result within 4 months. But I said it's very important that you still continue your treatment. And finally, this case demonstrates successful TCM intervention for acute serious skin conditions. And I always say TCM definitely can. And I also think that TCM is often better in those cases of Western medicine. This is a good example for this. So finally, I like to repeat the key clinical insights. As I said, TCM is effective despite severe initial presentation. Medication side effect recognition is crucial. Lifestyle modification is essential for long-term health. And integrated medicine approach is beneficial in such a difficult case. Yeah. You may remember COPD, hemophilia, AIDS, hypertension, hepatitis, yeah. Too many severe chronic conditions. And as I said, Alex, do we have the time for standard cooking times?
Absolutely. Well, we have the time on our side. I don't know if you have on yours, but we
I
have
have.
global. Yeah.
Yeah,
So we're
okay.
good. Go for
Okay.
it.
So I like to give you my standard cooking times for decoctions. I do it very fast because you can take a screenshot or take a picture and maybe you all have your own standard cooking times. So the standard soaking time for decoctions is 20 to 30 minutes. Standard boiling times, 30 minutes twice, using fresh water each time, of course, and then mixing both decoctions together before drinking. Standard intake of decoctions, 100 to 150 ml twice a day. The dose depends on the severity of skin disease, and in acute or severe cases, herbs can be taken up to 3 times a day. Always keep in mind, it's a very flexible process. Nothing is hammered in stone. My standard cooking times for washes and wet compresses. Soaking time, 15 to 20 minutes, a bit shorter. Standard boiling time, 20 minutes, once only. Imagine, decoctions have to work deep inside the body. They have to be strong, so you cook it twice and longer. Washes and wet compresses have to work on the surface. They have to be light, so boil it just once and a bit shorter. Standard application time, 15 to 30 minutes, depending on the severity of the skin lesions. This can be done once or twice a day, and in severe cases, even 3 times a day. How you need it. The liquids will stay fresh for up to 7 days when stored in the refrigerator, but should be assessed for freshness in appearance and smell before use. So they shall look and smell, and if it's not longer aromatic, should be discarded. Washes, wet compresses, all external treatments are very, very easy, but so helpful. Now, last slide. I wish you all the best of luck with your skin patients. Please remember, this is just the beginning for you, and you need to gain your own experiences. I always say, learn, treat, repeat. Dare to make mistakes, and if you do a mistake, you do it again. Next time you do it better. And also never forget, and some of you may remember that I have said this during the last course, but I think it's so important. You must use your own brain. You must use your own heart. Why I'm saying this? I'm happy to say it again. Why the brain? Because simply copying of formulas isn't enough. It will not work. It will just not work. And why the heart? Because a therapist's human qualities are just as important as their technical skills. Especially skin patients need a great deal of emotional support and caring attention. And I often have the feeling that this is not discussed during educations. You can speak fluently Chinese. You can remember all classic books, but if you don't have the personal ability to deal with difficult patients, to show, to bring empathy, you will not have a relationship to the patient, and without a relationship, the treatment will not so successful or not so effective. This is my opinion. And now I'd like to thank you for listening. I thank you for your attendance today. Sorry for the technical problems. I'm a practitioner, not an IT person. If you have questions, please ask. I'm happy to answer. And I didn't forget, I like to give you a short information about our project in China. So we are currently establishing the TCM Expert Committee at the World Sinology Council in Beijing. We are planning seminars on site or online, on site outside of China and in China. We are preparing a conference in China. So the date is not fixed yet. It will be set by the Chinese government, probably in summer, maybe also in November. We just don't know at the moment. But we are super happy to inform you. And if you like to have more information on that, send me an email or contact me through social media. And yeah, I'm very happy to share the information with you, and I'm sure it will be a great project to spread the wisdom of Chinese medicine. And now I like to give the word to Sarah. Maybe Sarah like to say something about upcoming ideas, what it's possible, what not. And if you have questions, please ask. Thank you.
Thank you, Sabine.
Yeah. Go ahead, Sarah.
Shall
Yes,
I end this full screen?
Yes, yes, you can. Yeah.
Okay. Ah, okay. All right. Okay. If you have any questions, please ask.
yes,
So,
maybe we go for the questions first.
yeah, go. Go ahead. You want to go to the questions first, Sarah?
Yes, maybe it's
Yeah.
better.
Okay. Okay.
Do I
Okay.
see it?
So, Lalik is asking, did the patient do the compresses twice a day? Most people don't do that.
He did. At least this.
Okay.
He didn't change his lifestyle, but he did the compresses. He did. He did. Yeah.
Also, Anna Martins is asking, maybe because blood issues take more time to see results. That's when that's a suggestion concerning the fact that after 10 days, the results were not optimal after the first 10 days of treatment.
Alex, I didn't get it. I'm searching the question that I can read it because I was so busy with the technique here. Where is it? Sorry. Where is
It's
it?
right after Lilik and Valentina. Anna Martins is asking that it's more of a suggestion. She's saying, after your first treatment, 10 days after, there were not many results. So she's saying maybe it's because blood issues take more time to see results.
I get it. Yeah, that's right. But if we use wet compresses, it should be faster. And I was not happy. Usually the results are faster. But you are right, it takes more time with blood issues. But if you use wet compresses, the healing process must be faster. So for this patient, I was not happy with the result. Maybe I'm impatient. Can be. Yeah.
That's a good thing, I think, for your patient. So, Marianne is asking, can you explain, please, the actions of Bai-Shen-Pi and Diffusi?
Diffuse is good in relieving the heat, stopping itchiness. Is a super herb for itchiness. The Baichen is also super for against the red skin, for the inflammation, and also stops the itchiness. And I often use it for external treatments.
Okay.
Especially if you see damp heat lesions, I usually combine Diffuse, cushion, 是庄子, Bai Shenpi, Huang Bai, Huang Jin. Usually this combination is super effective.
Very well. Lalik is also asking, can you explain with what you do the washes? What material? How to do
Yeah.
it?
Yeah, we have several options. For the face, for example, I often tell them to use, what's the English word? Is it called cosmetic pad? Makeup pad? We have different sizes and it depends on the size of the lesions. Yeah. So if the lesion is large, they should use the large pads, cotton pads. I think cotton pads, that's the right word. This is option one. They can also use these medical compresses, but I always say it's too expensive. So they should use, or they can use something else. They can use wash clothes. They can cut them and they can use it again, but they have to cook the fabric after using. Or towels, cotton towels. It's the same. They can cut it in the sizes they need, but they have to wash it at least 60 degrees before using the next time. So we have different options.
Very well. Helena is asking, what about eczema with children patient? Do we need to reduce the formula?
Yeah, I think yeah, here. Now I have it. Now I see where the comments are, Alex. Yeah,
Okay.
of course we have to reduce the dosages. I wouldn't reduce the number of herbs, no, but I would definitely reduce the dosages for children. And maybe another option for children, maybe you just boil the herbs once. Also an option to make it more mild. Boil them maybe just 40 minutes once and reduce the dosages. And of course, also reduce the intake of the liquid, of the decoctions. Of course, we work differently. And in my book, I have a complete section for children, and it's explained how I worked, how I work with children. But Helena, as I have seen, you have bought the book already, and I meet you in Cologne for book signing. You are invited. Helena is from Indonesia, and Helena is currently in Germany, so we will definitely meet.
Thank you, Lasse.
Yeah, of course you come to Cologne. And David, now I see the comments. There are seminars that project only on dermatology or is also to other TCM areas. David, do you mean my person or in general at global branches?
I think he means the TCM Sinology Congress, the project you were talking about in China.
It covers everything, David, everything. And it's up to us what we like to do because we give the ideas, we give the wishes, and then we bring it into reality. It's up to us. So, wide range. David says, for such a case of eczema, is it better to use compressors or also soaking the parts of the body? No, I don't prefer this because the skin is getting too soft, then cracks, and then maybe some contamination or some germs will spread. Not really. No. Okay.
And I think the rest is just a lot of compliments.
Thank you, thank you, thank you. And maybe Sarah, do you like to say something about ideas or nothing today?
I will say it just briefly because I don't want to take much time. But yeah, I'm very, very happy with this Congress, this future conference, and also the forums that we will have online. So the focus will be on the promotion of global dissemination of Chinese medicine, also overseas talent training and cultural exchange, and also translation of books and the classic books. So there is a lot of topics around the Chinese medicine topics, and all the people, we are interested in all the people that are interested and focus on this promotion of Chinese medicine by their own experience, also through the cultural and promotion of Chinese medicine in their areas, in their countries. So everyone that is excited about this, we will be glad to welcome and to exchange ideas for these future projects, of course. Thank you.
Thank you, Sarah. Guys, before I forget, Sabine just wrote a new book, as you can see in the picture, about treating eczema and neurodermatitis. You can get a Global Branches discount of 15% with a code. Adriana just shared it in the chat. We'll be sending you an email also with that information. And also, we've had the pleasure to host Sabine for quite a few courses on several different topics in dermatology acne, psoriasis, and rosacea, all of them available on our website for selling in case you're interested in seeing more of Sabine's technique when it comes to diagnosing and treating those kind of skin conditions. And thank you so much, everyone, for staying longer than expected from
My
from
fault.
the beginning. We're sorry for the initial start that was a bit late. Thank you so much for trusting us at Global Branches. Thank you so much, Sabine, for doing this with us. And I wish you all the best. And hopefully, we'll see all of you soon. Bye, everyone.